Aloha! Are you turning 65 or getting ready to retire? Thanks for joining me today for one of 3 sessions on Medicare, planning for your healthcare and retirement, and HMSA Medicare Advantage. In this session, I'll cover Medicare basics and enrollment, what to do if you're still working at 65, and what to do when you're ready to retire. Medicare is federal health insurance for people who are 65 and older, or for those under 65 with certain disabilities. There are 4 parts to Medicare. Part A covers inpatient services, like when you stay at the hospital. Part B covers medical services, like when you go to your doctor's office or need outpatient surgery. Part A and Part B are known as Original Medicare and include deductibles, co-payments, and co-insurance. Let's talk about what each of these things are. A deductible is the amount you pay before your benefits begin. A co-payment is a fixed dollar amount that you pay out of pocket when you get health services. And your co-insurance is a percentage of your covered services that you'll pay out of pocket. Part C is Medicare Advantage, which is provided by private insurance companies like HMSA. Our Medicare Advantage plans are all-in-one plans that have the same benefits as Original Medicare, plus extra benefits like vision, fitness, and travel. Our plans also include prescription drug benefits, which brings me to Medicare Part D. Part D covers prescription drugs and is also provided by private insurance companies. While Part D drug plans are sometimes sold separately, HMSA Medicare Advantage plans actually include your Part D prescription drug benefits with Original Medicare and extra benefits. Now let's talk about when you can enroll in Medicare. You can enroll during a 7-month initial enrollment period, in the 3 months before your 65th birthday, during the month of your 65th birthday, and for 3 months after your 65th birthday. Keep in mind, though, that when you apply determines when your Medicare benefits will begin. To prevent a lapse in your benefits, we recommend signing up for Medicare 3 months before your 65th birthday. To sign up, visit the Social Security website at ssa.gov or call them at 1-800-772-1213. Once you sign up for Medicare, you'll receive a Medicare Welcome Packet, Medicare Card, and the Medicare and You Handbook. If you miss your initial enrollment period, don't worry. You can still sign up during the Medicare General Enrollment Period, which runs from January 1st through March 31st. If you sign up during the General Enrollment Period, your Medicare benefits will begin July 1st. Since your coverage won't start right away, you might be at risk for a late enrollment penalty if you don't sign up on time. If you're late enrolling for Part B, Medicare may add a 10% penalty to your monthly Part B premium for every 12 months you weren't enrolled in Part B after you first became eligible. For Part D, if you go for 63 days or more without Part D creditable coverage, Medicare may add 1% of the national base beneficiary premium for every month after those 63 days until you are enrolled. These penalties are in addition to your monthly premium and will continue for as long as you have Medicare. Let's talk about how to avoid these penalties. Take the time to find out when you're eligible for Medicare, and then be sure to enroll on time. What if you're still working when you turn 65? You'll have some decisions to make. First, consider enrolling in Medicare Part A, which again covers hospital benefits. You can enroll in Part A at no monthly premium if you or your spouse has worked 10 years or 40 quarters in the U.S. With Medicare Part B, you can either enroll or defer your Part B coverage, depending on your situation. If your employer has less than 20 employees, you may need to enroll in Part B when you turn 65 to avoid a Part B penalty later. If your employer has 20 employees or more, or if you're covered under your spouse's large group employer group plan, you could defer Part B enrollment until you retire. After you set your retirement date and enroll in Part A and Part B, you won't have to do anything. you're all set with Original Medicare. However, if you've been deferring Part B and you'll no longer be covered under your employer plan, contact the Social Security Administration to enroll in Part B. You can enroll as early as 3 months before your retirement date. Keep in mind, though, that if you're still covered under your spouse's large employer group plan, you may continue to defer Part B until your spouse retires and loses coverage. And think about your health plan options in retirement to give you enough time to shop for the right plan and to enroll. If you have any questions, we'll be happy to help you on the phone, online, or in person. Thanks so much for joining me today. As always, HMSA is here with you. Mahalo!